So we did prescription drugs, and just a quick statistic about that is 11.4% of young people ages 12 to 15 used prescription drugs non-medically last year, so it's obviously a big problem. And so we just focused on 3 specific ones, and I did Adderall. And Adderall is used to treat those with ADHD, and it's classified as a central nervous system stimulant. And a lot of people take it to stay up longer, increase their ability to focus, pay attention, and control behavior. And so that kind of links to like doing better on tests and papers and being able to study longer. So the use of Adderall is kind of linked to the strive for perfectionism in our society. And estimates show that Adderall is the most abused prescription drug in America. 20 to 30% of college students and young adults are typically using it, abusing it. And it's typically a problem in college students just because like of the stress to do well to get a job. But especially in high school such as here where it's very like academically rigorous, it can be a problem. And some also use it for weight loss because it decreases their appetite, and it's known as the study drug or an academic steroid. And you kind of get caught in a cycle, so you get addicted and you can't sleep. And then side effects are if you overdose, it increases your inability to sleep, and then you have psychotic episodes such as schizophrenia or hallucinations, and then you can go into cardiac or pulmonary arrest, and if you abuse it too much, you can die.
Okay, so I did oxycodone, and it's related to the drug Oxycontin, but it takes effect quicker. So Oxycontin takes effect like about 3 hours, but oxycodone starts working in your body within an hour. And it was first developed in like 1916 as like a pain reliever, and it's in the group of opioid analgesics. It's narcotic pain relievers, and so it's used for ADHD, people who have ADHD, to treat their symptoms of stress and anxiety. And it blocks. It's also like prescribed after surgery because it blocks pain messages to the brain. Some of the common nicknames for it are Oxycontin killers and even hillbilly heroin. And in terms of like addictive levels, it's like morphine, but like a little bit more addictive. And one of the most common side effects or problems with the drug is its dependence. Users, they feel like they go into a euphoric state, but the biggest problem that they have with it is dependence because it's so highly addictive. Newborns, like a lot of newborns that have been tested, have shown dependence on the drug because their moms are injecting it or inhaling it. And the most common side effects are constipation, fatigue, dizziness, nausea, vomiting, dry mouth, itching, and sweating. And the long-term effects can, if you overdose, it's increased dependence or high dependence, and it's lethal if you overdose it. Yeah.
Okay, so I chose Vicodin, which is hydrocodone and acetaminophen combined. And so it's an opiate, so it's basically just as addictive as heroin. So it's really addictive. And people take it because it gives them a euphoric feeling, because while it blocks pain messages sent to the brain, it also relieves anxiety in a way because your brain kind of slows down. It can be taken in a pill form, crushed, or snorted. And acetaminophen is harmful to the liver in strong doses. So some frequent users of Vicodin will sometimes extract the hydrocodone out of it, and so it's a liquid. So you can inject, or you can take the liquid orally, or you can inject it. So you can see it. It's a pill, crushed up, you can snort it, or you can take it through a syringe. Side effects include itching, nausea, paranoia, and yeah, basically intense paranoia. The most common dosage is 10 to 15 milligrams, which is how much you're given normally after a surgery. That's why it's normally prescribed if you break a bone or if you've had major surgery. And 20 to 30 milligrams is considered a high dose. But if you're abusing it, you build a tolerance for it, so people will take more and more of it in order to achieve the euphoric feeling. So some people take up to 60 milligrams, and this is an extremely high dose. And it's so high, some people say that you don't even get the euphoric feeling anymore, you just get the strong side effects. In an overdose, you can get cold and clammy skin, and you can extreme sleepiness that progresses to a state of unresponsiveness or even a coma. Heart failure, renal failure, slow heartbeat, trouble or slow breathing, vomiting, you name it. And so, basically I have pictures, I don't have them, I don't know where I put them, but they show all the side effects of Vicodin, and we'll put